This video is about a surprising link between some prescription medications and memory loss. Most people assume that if a doctor prescribes something, it must be safe, especially if it's common. But here's the twist. Some of the most widely used medications in the world, for sleep, allergies, anxiety, and even overactive bladder, can interfere with brain function, especially in older adults. Multiple studies have found that certain medications may increase the risk of confusion, brain fog, and even long-term cognitive decline. A large study published in JAMA Internal Medicine found that seniors who regularly took strong anticholinergic medications had a significantly higher risk of developing dementia. In fact, those with the highest cumulative exposure had a 54% increased risk compared to those who didn't use them. Other studies have confirmed this association, particularly in people over age 65. The risk is dose-dependent. That means the longer and more often someone uses these drugs, the greater the potential for harm to memory and thinking. And this isn't fringe science. These findings have been supported by the National Institutes of Health, Harvard Medical School, and the Mayo Clinic. Because these drugs are sold under different names and often for different conditions, most people don't realize they fall under the anticholinergic umbrella. That means millions of older adults may be unknowingly increasing their risk of memory loss or cognitive decline every single day. Start by reviewing your current medications, both prescription and over-the-counter. Look especially at sleep aids, allergy meds, bladder control drugs, antidepressants, or anti-anxiety pills. Ask your doctor or pharmacist directly. Does this medication have anticholinergic effects? You can also search online using reliable sources or consult lists like the Beers criteria, a guideline used by geriatric specialists to identify medications that may be inappropriate for older adults. Remember, this isn't about stopping medication on your own. It's about becoming an informed partner in your healthcare. If you've recently started or increased a medication and notice any of the following, take note: increased forgetfulness, difficulty concentrating, feeling mentally slower, more frequent confusion or disorientation, or trouble with daily tasks that used to feel easy. These may be temporary side effects, or signs that your brain isn't tolerating the medication well. Sometimes the symptoms are subtle and build over time. That's why it's important to stay aware and track changes. First and foremost, do not stop taking any prescription medication without medical guidance. Stopping suddenly can be dangerous, especially for antidepressants, heart medications, or bladder control drugs. Instead, make an appointment with your doctor. Bring a full list of what you're taking, including supplements and over-the-counter products. Let them know your concerns and ask if there are safer alternatives. In many cases, doctors can switch you to a medication with less anticholinergic activity or adjust the dosage to reduce side effects. In addition to reviewing medications, there are daily steps you can take to support brain health. Get regular exercise. Prioritize sleep. Stay socially connected. Eat a Mediterranean-style diet rich in leafy greens, berries, fish, and olive oil, and keep your mind active with reading puzzles or learning something new. And of course, always keep your care team informed of any changes in memory, mood, or thinking. Your brain is like any other part of the body. It needs the right environment to thrive, and avoiding harmful medications is part of that environment. It can feel scary to learn that a common medication might be harming your brain, but knowledge is power. By understanding what to look for, asking the right questions, and staying engaged in your healthcare, you can make better choices for your brain and your future. There are many medications that are safer for older adults, and with the right support, it's absolutely possible to protect your memory and your quality of life. You're not alone in this, and you deserve to feel confident in your health decisions. If you found this video helpful, please consider subscribing to Silver Memory. We share weekly, trusted insights on brain health, memory, aging, and cognitive wellness. Because your mind matters and every small step counts. Stay informed, stay encouraged, and take good care.